Hello everyone, how are you? Uh, Welcome again for this session, and for those who are taking the Osce exam, we wish you the very best. And today I'm going to take you through how to do assessment for neuro patient. This is one of the skills that is considered to be a bit tricky, but it's manageable, guys. So for the neuro patient, you need to take note of time, because there are a lot of things you are going to examine, unlike other assessments for other types of patients, for the most, for the PHQ-9, or even for the news. So for neuro patient, like any other procedure, you will consider check your scene safety, then approach the scene, do your hand hygiene using the 7 steps of hand hygiene, then approach your patient. I'm Vincent Ovita. I'm the nurse going to take care of you today. Kindly your names, okay, and your date of birth. Then double check that one with the patient's ID and ensure they all coincide. Then from there, check the patient's allergies to food, plaster, and any medication. If there are wristband, kindly double check with that one, because that's a critical issue. After that, check for pain, and if it is there, kindly rate it in a scale of either 0 to 3 or 0 to 10. And reassure your patient concerning the pain if it is there. After that, you will tell the patient, now I'm here to take a set of observations that will help us monitor you efficiently. In the process, I'll also assess your eye, verbal, and motor response. Are you okay with that? Thank you very much. I'll just prepare my equipments, then come back. Are you happy with that one? Okay. Do your hand hygiene, then proceed to your preparation area. Then now, in the preparation area, assessor, are all my equipments clean, calibrated, and ready for use? Yes. Okay, you will do a full hand wash with soap and water. Wet your hands. Put sufficient amount of soap. Do palm to palm. Palm over dorsum, fingers interlaced, fingers interlocks, fingertip rotation, tip rotation, thumb rotation, wrist rotation, then rinse, close the tap with your elbow, paper towel, dry them to the general waist, put on a clean apron, put on clean gloves. Have all your equipment, that including the blood pressure machine, the pen light, a tympanic thermometer, and you should also have your SpO2 probe in place. With that one, combined with the writing materials, you are going to record your vitals. Proceed back to the patient. To the patient, you have to welcome the patient again to the session, ask for permission to proceed, then you will proceed with their blood pressure. So which arm would you like me to use? Then the patient will give you direction of whether the right or the left. Kindly ask if they've had any surgeries on that arm or the breast aligning to the arm, because that one might not provide some objective result, especially if surgery had been done on the hand, you have any lesions or any wound on that site. Visualize the site. With that one, go ahead, place the curve. Assessor, I'm going to place the curve covering 80% of the arm and 2 centimeters above the antecubital fossa. You just use your arm to place like this, and that's where the curve will start. Then instruct the patient that he or she might feel some tightness, and in case he wants that to be stopped, let him inform you. Then start your BP. While the BP curve is reading, concurrently take your SpO2 and endeavor to check for fake nails or artificial nails. Also check for capillary refill time. Capillary refill time, it should be less than 2 seconds. With that one, let this one take concurrently. While the BP is reading and the SpO2 is also reading, take the temperature immediately. You use either of the ear. Ask the patient if they use the hearing aid. If they use the hearing aid, maybe on the left one, use the right one, and ask for any surgeries. Then check, assess. I'm going to check the ear for any wax in compartment. Pull the ear up and backwards, access the ear canal if there's any wax in compartment. If it's clear, go ahead and take. And ensure you take the clean probe from the holder. Take a clean probe, and that one you only take after switching the tympanic thermometer on until it gives you a signal that place the probe. After placing the probe, go in slightly into the ear, then press the button. It will give you a reading. Remove and directly discard to the clinical waste while noting the temperature, and remember to tell the assessor. The temperature is 36.5. I'll now discard the probe to the clinical waste and kindly discard it. After that, record 36.5. Then now with that one, you've already had your blood pressure and the oxygen saturation. Tell the patient also, David Jones, your blood pressure is 125/65. Thank you so much. And your oxygen level is 98%. And you note it down. Remember, note it down as you are saying it so that you don't get confused, and also you don't forget or give a different reading and write a different one. After that, you will remove all that. Then now you go on to checking the respiratory rate and the respiratory rate and the pulse rate. In this case, give clear instructions to the patient and tell the patient, David, I'm going to take your pulse rate. I'll request you to maintain silence during this period so that I concentrate on the counting. And I'll take two full minutes. Are you okay with that? Now I'll take that one from your wrist. Which wrist you really like me to use? Give your preference. And now locate the radial artery, the radial pulse. Assessor, I'm locating the radial pulse, and here I have it, and I start counting. Count that for a whole minute. After 1 minute, without informing the patient, take the respiratory rate. And remember, during the entire 2 minutes, you are supposed to maintain silence also to concentrate on the counting. At the same time, don't inform the patients or while taking the respiratory rate. When the 2 minutes are over, and remember to wait for the entire 2 minutes. When they're over, report to the patient. Your pulse rate is 75, and your respiratory rate is also 15. Now then report to the assessor. Assessor, I took 1 full minute to take the pulse rate, checking for rate, depth, and rhythm. And the next 1 minute, I took the respiratory rate, checking for any signs of respiratory distress or use of accessory muscles. And I also didn't tell the patient because it would have altered the readings. Record those readings. Then now after that, go ahead with the neurological assessment. So David, I'm going to check the reaction of your pupils. I'll splash some light into your eyes. Are you sensitive to light? No. Do you have contact lenses? No. Do you have do you have anything that can buy you from seeing or anything? After that, or cataract. After that, we'll use a pen light. I'll tell the patient, I'll request you to focus on one point, then in that one splash the lights from out inwards, then again from out inwards. Determine the reaction of the pupil. Record it according to the size you've seen. It can be a 3 and it is reacting briskly, so positively, so it will be a 3 plus for both sides. After that, check the powers of both the upper and the lower limbs. Give clear instruction. David, I'll request you to lift both of your arms. I'll press against them and I'll request you to push the pressure back. And now you will determine whether it's weak, normal power. In case all of them have normal power, you will write RL, that is right and left, on the portion of normal power. Then go to the lower limbs. Request the patient kindly raise both of your legs up. Raise your legs. Then put pressure against and let the patient resist. After that, you will determine which one is weak, whether it's normal power, mild weakness, or no response, according to your findings. After that one, request permission to go and record your findings. Also remember, you are assessing the neurological status all this period. That is the eye opening, verbal response, and motor response, even without telling the patient, but you had verbalized to the assessor prior. Take note for neuro patient, most likely your patient will be confused and may keep on asking, where am I? Am I in hospital? Am I at home? Who will take care of my kids? Who will take care of my pet, my cat, and all that? Who will feed? Is my daughter around? Take note of such and keep on reassuring your patient professionally, recognizing their worries and also settling them so that you maintain your course, or else you will be taken off the time. After having all these readings, request the patient to go and record them. He or she will permit you. While now recording these ones in your chart, take note of certain things. You will start from up. You have time, yeah. Start from writing your time. You write time in 24 hours. It can be like 10:30. Then eye opening. If your eye opening was spontaneous, write 4. If you found your patient, maybe the eyes were closed, then when you started talking, that's when they opened them. Take note of that one. They only responded to the sound. Score it 3. During that period, the patient most likely will manifest some confusion, and you have to record it as 4. The patient may obey commands because lifting the arm and all that one, record it as 6. And when you get that one, your GCS score down here will be 13. Okay, then proceed. After that, you had recorded your temperature as 37.5. Go to the column at 37.5 and remember to mark it correctly, 37.5, and put an X. Okay, after that you will have your blood pressure. You said 125 over 65. Place an arrow at 125, another arrow at 65, join them via dots. Then your heart rate, maybe it was 85. Go at 85th mark within the same line and put a visible dot. Remember, it have to be visible for assessor to take note of it. And if maybe you don't want it to be in the same line with the dotted lines for for the blood pressure, you can put it aside, but within the same line where you are making your recordings. Your respiratory was 15. Just there's a point down there which is indicated respiration. Just below the 20th mark for the blood pressure, right there 15. Record the pupil reaction size, that is 3 positive, 3 positive. For the arms and the lower movement, write either RL for both powers under the same line, because both the right and the left were of the same, had normal power. Then for the legs, do the same. Total GCS score you've recorded to be 13. Oxygen saturations 198, remember to record that. Then your initials. Don't write your names, don't give a signature. If it is initials, give initials. I'll give VO, Vincent Obita, VO. After that, counter check if they are the same line, if you've done the correct thing, because that's very critical. You miss that one, you will be penalized. After that, you will go back to the patient. Now, David Jones, I'm back. How are you doing? I'm back with the result. From the set of observations that I took, your vital signs were within the expected range, not normal, within the expected range. However, I also assessed your neurological status, and out of 15, I gave you a score of 13, okay? And this one will prompt me to observe you more frequently, that is every 30 minutes. Remember to give the timelines for your observation. I'll continue to observe you every 30 minutes until this score gets to 15, okay? Are you happy with that one? Okay, thank you. And keep on reassuring your patient you are in hospital and we are taking care of you and you will be fine. At the same time, tell the patient for the other observations, we will continue doing them 4 hourly to ensure you are safe at all times. Is that okay? It is that during this period, if you have time, you can discuss other activities of daily living, how the patient is taking their medication, if they are on any long-term medication, how are they faring on with maybe their nutrition, their water intake, hydration. Take note of these problems, and remember, prior to assessment you will have some 5 minutes to read the patient's scenario, their medical history, their social history. If they are either smoking or taking any alcohol, you can talk about reducing, not stopping, okay? Or any patient preference. But take note during this session, what is major is on the confusion, and you are supposed also to explore any element that will help you do your care plan. For the neuro patient, the care plan will revolve around confusion, yeah, the GCS. Then you will add another element. This can be pain. So if your patient has no pain, no need to take pain as an example. You can explore other elements, but explore an element that will help you do your care planning, okay? That entails entire thing about neuro patient, and you need to take note. You have to take charge of this patient. Keep on reassuring. If you don't reassure them, they will keep on probing you, and this might waste your time, and that's what most people fear about the neuro patient assessment. Thank you so much, and hope to meet you again. Remember to continuously like my videos, and also subscribe to my channel for more information about Osce and all it takes to go through the Osce exam. Thank you so much, guys, and I'm really happy for you. Thank you.